6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13, Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily gentle skincare is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily, reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin's surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated products. Oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol, cost $5 to $30 per product and are usually affordable. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-500 plus per month, even though the generic is relatively affordable. However, Insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20 to $100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments: chemical peels $150 to $300, laser $400 to $1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100 to $300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies: start with over-the-counter treatments, use generic prescription medications if needed, ask dermatologists about patient assistance programs for expensive medications, consider community health center dermatology if cost is barrier, check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines, and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments: bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75. Acne in specific professions: pilots, surgeons, healthcare workers, and others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and sweat. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Non-compliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Combining retinoids with other acne treatments provides advanced results. After retinoid tolerance is established, typically 8 to 12 weeks, carefully introducing benzoyl peroxide on different days, perhaps retinoid at night, benzoyl peroxide in the morning or on different evenings, can enhance overall acne control. However, this requires careful management. Combining retinoids with strong treatments too early in the process causes excessive irritation. Wait until you're using retinoids nightly without significant irritation before attempting combination with benzoyl peroxide. Combining salicylic acid with retinoids requires similar caution. Both are exfoliating and somewhat irritating, so combining them immediately is unwise. After 8 to 12 weeks of stable retinoid use with good tolerance, you might use salicylic acid cleanser in the morning and retinoid at night. The salicylic acid provides daytime exfoliation and sebum control, while retinoid provides nighttime cellular turnover and anti-inflammatory benefits. Oral antibiotics plus retinoids represent an advanced combination for moderate inflammatory acne. The antibiotic controls bacterial inflammation while the retinoid addresses cellular turnover and sebaceous gland normalization. This combination is particularly effective for acne resistant to topical treatments alone. However, careful introduction is necessary. If possible, Allow 4 to 8 weeks of antibiotic therapy before introducing retinoids, then start retinoids at low frequency and concentration. Hormonal treatments combined with topical treatments represent a synergistic approach for hormonal acne in women. Oral contraceptives or spironolactone address the hormonal root cause, while topical treatments manage surface acne manifestations. This combination often provides superior results to either approach alone. For example, a woman might be on spironolactone plus doxycycline plus benzoyl peroxide, addressing hormone regulation, bacterial factors, and inflammation simultaneously. Chemical peels combined with home treatments provide enhanced results. Monthly superficial chemical peels combined with daily topical acne treatments provide more dramatic results than either approach alone. The chemical peel removes surface impurities and promotes cellular turnover, while daily treatments maintain and enhance the peeling results. Vitamin C plus niacinamide represents a complementary antioxidant combination that doesn't directly treat acne but provides skin-supportive benefits. Both are non-irritating and well-tolerated together. Apply vitamin C in the morning for antioxidant protection, and niacinamide can be included in morning or evening moisturizers. These support overall skin health during active acne treatment. Important principles for combination therapy. Never introduce multiple new treatments simultaneously. If you want to combine treatments, introduce them sequentially. Establish tolerance to one treatment before adding another. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While "drink water for clear skin" is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily water intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. Individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne is limited. Chlorinated water can irritate acne-prone skin. Chlorine is drying and potentially irritating. Using filtered water for cleansing if you have highly chlorinated tap water might help. However, most chlorine in tap water is minimal and unlikely to significantly impact acne. Hot water is more drying to skin than lukewarm or cool water. Cleansing with lukewarm water rather than hot water reduces water-related dryness, particularly important for acne-prone skin already potentially compromised by active treatments. Distilled water versus tap water has minimal practical difference for skin health. Distilled water is free of minerals and chlorine but also lacks beneficial minerals. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12. Treating post-inflammatory hyperpigmentation and acne scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, niacinamide shows improvements in pH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azalex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to 8 weeks. Kojic acid inhibits melanin production. Available in serums and creams at 1 to 2% concentration, applied daily, kojic acid gradually lightens hyperpigmentation. Results take 4 to 8 weeks of consistent use. Kojic acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called achronosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light, therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are three main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist, though complete elimination is often impossible. The goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skin care products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skin care. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, SICA, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain SICA for its barrier-supportive properties. Using a SICA-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure. Wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function. Some people find that once their barrier recovers, they can maintain clear skin with gentler treatment than they used before barrier compromise. For example, someone might have needed 2% salicylic acid daily and benzoyl peroxide to control acne, but after barrier recovery and switching to gentler 0.5 to 1% salicylic acid with retinoid maintenance, their acne stays controlled. This suggests that excessive barrier compromise actually worsened acne by disrupting skin function. Prevention is better than recovery. From the start of acne treatment, use appropriate concentrations and frequencies, incorporate moisturizing and barrier support, and listen to your skin's signals. If your skin is becoming very dry, tight, or reactive, reduce treatment intensity rather than continuing and causing more barrier damage. Long-term consistency matters more than short-term intensity. Guide 27. Cosmeceuticals and advanced skincare ingredients beyond standard acne treatments. Beyond the well-established acne treatments like benzoyl peroxide and salicylic acid, numerous cosmeceutical ingredients support acne treatment and skin health. Understanding these advanced ingredients allows you to optimize your acne regimen and support overall skin function. Peptides are short chains of amino acids that support skin structure and function. Some peptides have been studied for acne-supportive effects through anti-inflammatory mechanisms and barrier support. Matrixyl and similar peptides appear in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well-tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and anti-mental health professional if psychological distress is severe. Combined medical and psychiatric treatment can be necessary and appropriate for some individuals. The timeline of acne treatment has psychological implications. Understanding that improvements typically take 8 to 12 weeks reduces the despair of not seeing immediate results. Knowing that this is normal rather than treatment failure helps maintain consistency during the early phases when visible improvement hasn't yet occurred. Guide 29, Acne-Safe Cosmetics and Makeup, products that don't trigger breakouts. For many people with acne, cosmetics worsen breakouts through pore clogging or ingredient irritation. Understanding acne-safe makeup and cosmetics allows you to use cosmetics without exacerbating acne. This is particularly important for those using makeup for confidence or professional purposes. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. This condition differs from acne triggered by other factors; it's purely product-induced. Recognizing whether your acne is acne cosmetica helps you address the root cause, stopping or switching the cosmetic product. Non-comedogenic labeling indicates products formulated not to clog pores or trigger acne in most people. However, non-comedogenic is not strictly regulated by the FDA, and what's non-comedogenic for one person might be comedogenic for another. Non-comedogenic labeling provides guidance but isn't a guarantee. Foundation is perhaps the most likely cosmetic product to trigger acne, as it's applied to large facial areas and remains on skin for extended periods. Silicone-based foundations often trap bacteria and sebum more readily than other formulations. Oil-free, water-based, or mineral foundations are generally better tolerated by acne-prone skin. Powder foundations allow better skin breathing than heavy liquid foundations. Additionally, looser application, don't cake it on, reduces pore clogging. Primers can exacerbate acne by creating an occlusive barrier over skin. If you use primer, choose lightweight formulations and don't over-apply. Some people with acne find that skipping primer entirely reduces breakouts without sacrificing makeup staying power. Concealers often contain heavy pigments and binders that can clog pores. Use sparingly, focusing concealer only on areas actually needing coverage rather than applying all over the face. Cream concealers are often heavier than stick or powder formulations. Powder concealers are generally lighter and better tolerated by acne-prone skin. Blushes in powder form are generally better tolerated than cream or liquid formulations. Mineral-based blushes are often less problematic than other types. Apply blush lightly; heavy application increases pore clogging risk. Setting sprays and powders can help prevent foundation migration while reducing the need for heavy foundation application. Light powder setting rather than additional product buildup can actually improve makeup longevity while reducing acne trigger risk. Eyeshadow, eyeliner, and mascara are less likely to trigger facial acne, unless you're rubbing your eyes and transferring product to your face. However, avoid eyeshadow that falls onto your cheeks or near your cheekbones where it might clog pores. Waterproof mascara and eyeliner can be harder to remove, potentially leaving residue that accumulates and irritates skin. Ensuring thorough removal of eye products is important. Lip products can contribute to acne in the perioral area. Heavy, occlusive lipsticks might trigger breakouts around the mouth. Lighter formulations and careful removal reduce this risk. Some lip products contain irritating ingredients that, while not technically triggering acne, irritate the perioral skin, making breakout appearance worse. Makeup brushes and applicators accumulate bacteria, dust, and product residue. Dirty brushes directly transfer bacteria and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore-clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30: Building Your Perfect Personalized Skincare Routine, Complete Advanced Framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1. Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatment. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last-resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing. The individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans feminine individuals, typically improves acne over time as androgens are suppressed. Many trans feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55. Nutritional deficiencies and acne, zinc, vitamin D, selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Guide 63, Acne in Patients with Liver Disease and Metabolic Disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dl is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dl, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation, irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations, lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92. Acne prevention in high-risk children and adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93. Acne in performing arts and image-dependent professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94. Acne and sleep disorders, managing acne while managing sleep issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretical. Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, Non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54: Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed